Hi guys, welcome to Dental Box. Here we are again going to discuss the cranial nerves in details. I'll tell you the origin, the type, the functional component as we have discussed it in our previous slide in a much more detail in the functions, and later on we'll discuss the lesions, that what will happen if there is a damage to the nerve, right? First we're going to discuss the olfactory nerve, that is the first cranial nerve. It originates from the skull via cribriform plate. Just keep in mind that these two first and second cranial nerves are the only nerves that are not coming out of the brainstem, while rest of all these are coming out from the brainstem, right? The first is the olfactory nerve. It coming from the cribriform plate. The type is sensory. It has only a sensory fiber. There is no motor fiber. So the functional component it has is a special visceral afferent. Special visceral afferent. It means it is only carrying the special senses, that is from the hearing, vision, and balance. That is, and it carry the sense of smell, right? The function, the first nerve that is olfactory carrying is smell. It is olfactory nerve, so it is carrying the function of smell. Right after that, we have the optic nerve that is coming out of the brain via the optic foramen, and the functional component is special somatic afferent. And then we have the function this optic nerve is doing is of vision and the pupillary reflexes. Vision and pupillary reflexes. And then we have the third nerve, that is the oculomotor nerve. It is coming out of the brain via the superior orbital fissure, right? It is a motor nerve. It has both it is doing the motor function. The special components are journal somatic efferent and the journal visceral efferent. These components we have discussed earlier. Journal somatic efferent means it is moving the extraocular muscles, right? And journal visceral efferent move, it is our parasympathetic fibers, right? The function it is carrying is it is helping in ocular movements. It helping in meiosis and convenience and accommodation, right? The function of these are ocular movements. It is a motor function. Ocular muscle movements help in meiosis and accommodation. It is from the third nerve, that is motor. And then we have the fourth nerve, that is the trochlear nerve. It is coming out of the brain via the superior orbital fissure. It is a motor nerve. The functional component journal somatic efferent, and the function it is carrying is it helps in turning the eye down and lateral, right? Fourth, turns eye down, and lateral movement of the eye is carried by this fourth nerve, right? After the fourth, we have the fifth nerve, which is the trigeminal nerve. It is the mixed nerve. It carries both sensory, motor, and the parasympathetic fibers, right? The GSE is journal somatic efferent. Journal somatic efferent. And then we have journal special afferent. It means it is carrying the pain sensation from the face, and special visceral efferent, right? It is applying the muscle of mastication, that is it is why special visceral efferent, right? Now the main function of it is applying the facial muscles. It is not a muscle of mastication. It is a help in turning the eye. No function in the eye, but it has muscle of mastication and muscle of facial expression. It is supplying muscle of mastication and to muscle of face, muscles of face, right? And then we have the sixth, which is the abducent nerve, right? The sixth, it is helping in turning the eye laterally. Six, it helps in turning the eye laterally. Turns eye lateral because it is a motor, so it has to do some motor function. So it is turning eye lateral. It has only one functional component, somatic efferent. Then we have seventh cranial nerve, that is the facial nerve. It is very important cranial nerve. It has it is mixed. It contains all the fibers, and it has journal somatic afferent fiber, journal visceral efferent, journal visceral afferent, right? So journal visceral efferent is why, because it's trying to measure facial expression. Journal visceral efferent is why, because it is carrying the parasympathetic fibers to the salivary glands, right? Special visceral afferent, it is why, because it is carrying taste sensation, right? From here you can guess the different functions. So the functions, it is supplying to the salivary glands. It is supplying to it has a taste taste sensation. It is supplying salivary gland the taste sensation. It is also supplied to the external ear. It also supplying to the soft palate, and it has also supplying facial expression muscles. Right? And then we have 8, which is the vestibular cochlear nerve. It is coming out of the skull via the internal acoustic metal. It is sensory nerve. It is helping in hearing. Special somatic afferent that is helping in hearing. Right, then we have jugular foramen. Then we have a 9th cranial nerve, which is the glossopharyngeal nerve. It is coming out of the brain via the jugular foramen. It is mixed nerve. These are all the components that are doing all the functions. The function, it is helping auricle sensation. And then we have, it is also supplying the posterior 1/3 of tongue. Supplying the posterior 1/3 of tongue. It is taste sensation to posterior 1/3 of the tongue, and it are also carrying the oxygen and carbon dioxide monitoring in the body by supplying to the carotid body. Then it is also supplying parasympathetic to the parotid gland. All glands of the face are supplied by the facial nerve except the parotid gland, which is supplied by the glossopharyngeal nerve. It also supplies the muscle that is stylopharyngeus. Now there is a 10th cranial nerve, which is a vagus nerve. It is coming out of the skull via the jugular foramen, right? And it has the functional component is special visual efferents, and it is supplying to the vagus nerve. It is supplying to the diaphragm, esophagus, and the uvula, right? Esophagus and uvula. Then there are 2 nerves remaining, which is the 11th nerve, which is accessory nerve, right? It is coming out of the brain via the jugular foramen. Right? And it has it has components that do not carry any specific functional components. It is a type of mixed nerve. Motor. It is motor. It is supplying to sternocleidomastoid muscle. It is supplying to trapezius muscle, right? And then we have the last one, which is hypoglossal, that is coming out of the brain via the hypoglossal canal. Right? It is supplying to, it is motor, it is also motor, hypoglossal. It is supplying to the it is 12th now, right? So it is helping swallowing. It helps in swallowing. It's applied to tongue. It is a motor function to the tongue, right? This is all for these. And now we're going to study the lesions of each of every one in details, right? So here I'll tell you about the lesion. What happens when there is a lesion of these nerves? Okay, remember this in your mind. Now we'll tell about the first nerve. Lesion of the first nerve we have is the olfactory. First, when there is a lesion of olfactory, we have a loss of taste sensation. Smell, na? We have loss of taste. Oh, sorry, smell. We have loss of sense of smell. Why it happens? Due to trauma and due to meningitis. Right? The next one we have the second nerve, which is the optic nerve. The lesion of the optic nerve led to optic atrophy. Right? And it led to scotomatia. I hope I am pronouncing it right. Scotomatia. That is the diminished vision within the visual field, right? It happens due to ischemia and edema, right? Then we have the third nerve, which is the oculomotor nerve. The lesion of the oculomotor led to diplopia, double vision. It is mostly due to trauma, right? Then we have the fourth, which is the trochlear nerve. The lesion of the trochlear nerve will lead to the pain in the face as it is applied to the forehead. Pain in forehead, and there is Sorry. It will not lead to the pain in forehead, but fourth one led to the vertical diplopia. There is a vertical diplopia that is mostly in the Graves' disease. Graves' disease. Then we have fifth, the trigeminal nerve. The lesion of this nerve will lead to the pain in the face, mostly in the forehead, right? And there is a clenching difficulty. It is at a motor function to the muscle of facial expansion. Clenching difficulty. It is due to neuralgia, or might be due to the herpes virus, or any carcinoma. Right, then we have the sixth, that is the abducent nerve. The lesion of this nerve will lead to the difficulty in facing the medially and cannot move. The eye will face medially but unable to move it laterally. Unable to move eye laterally, right? Lateral. This is mostly due to any trauma. This is due to the trauma or any cerebrovascular differences. Then we have the facial nerve. That is a mixed nerve. The lesion to this nerve will lead to a difficult in the facial expression difficulty. Facial expression difficulty, and there is led to the Bell's palsy. Bell's palsy. And impaired taste sensation. Taste impaired. Right, this is also due to the trauma. Then we have 8, that is the vestibular cochlear. The damage to this nerve will lead to the hearing damage. The hearing damage, the vertigo, and tinnitus. It is also due to trauma. And then we have the glossopharyngeal nerve. The damage to the glossopharyngeal nerve will lead to the pain in tongue, throat, and tonsil. As is more tongue, pain in tongue, throat, and tonsil. It is due to the fistula. Any fistula or damage to the nerve. Or damage to nerve. The remaining ones are the 10th, 11, and 12. The 10th nerve is vagus. The damage to vagus nerve will lead to dysphagia at help in swallowing, dysphagia, and harshness of voice and pain. This is due to the compression of the nerve. Compression of nerve. Then here comes the 11th one. The damage to this, as it is planned, is sternocleidomastoid and trapezius muscle. Then there is a paralysis of sternocleidomastoid muscle and trapezius. We are unable to move the shoulder up. It is mostly due to the gunshot. Then we have the hypoglossal nerve. It is applying to the tongue, and there is that is arthria and swallowing difficulty. Arthria, swallowing, and movement of tongue difficulty. Tongue difficulty. It is most commonly due to the nerve damage. This is all for the functional components of and along with their functions and the lesions of each and every nerve.